What happens when dementia progresses? It becomes harder to perform regular daily activities and self-care as dementia progresses. Common symptoms during this stage include increasing confusion or poor judgment, greater memory loss, including a loss of events in the more distant past. What causes dementia to progress quickly? Creutzfeldt-Jakob disease causes a type of dementia that gets worse unusually fast. More common causes of dementia, such as Alzheimer's, Lewy body dementia and frontotemporal dementia, typically progress more slowly. Through a process scientists don't yet understand, misfolded prion protein destroys brain cells. What are the 7 stages of dementia? What are the 7 stages of Alzheimer's disease? Stage 1, no impairment. During this stage, Alzheimer's is not detectable and no memory problems or other symptoms of dementia are evident. Stage 2, very mild decline. Stage 3, mild decline. Stage 4, moderate decline. Stage 5, moderately severe decline. Stage 6, severe decline. Stages 7, very severe decline. How quickly does dementia progress? Clinical Dementia Rating (CDR), Clinical Dementia Rating (CDR), Scale Stage Expected Duration of STAGE. CDR-1 Average Duration is 2 years, CDR-2 Average Duration is just under 2 years to 4 years, CDR-3 Average Duration is 1 year to 2.5 years. Can dementia get worse suddenly? Symptoms specific to vascular dementia. Vascular dementia is the second most common cause of dementia, after Alzheimer's. Symptoms can sometimes develop suddenly and quickly get worse, but they can also develop gradually over many months or years. At what stage of dementia does sundowning occur? Behavior changes. This is often referred to as sundowning. This pattern may continue for several months and often happens in the middle and later stages of dementia. Sundowning may be caused by disturbance to the 24-hour body clock that tells our bodies when to sleep, caused by the physical changes to the brain. What is end-stage dementia? Dementia is a progressive brain disease. A person with dementia will follow a fairly typical pattern of decline, although the pace at which this occurs will vary. Eventually, your loved one will reach the late stage of dementia, also called end-stage dementia or advanced dementia, in which symptoms become severe. What is the last stage of dementia? Sometimes called late-stage dementia, end-stage dementia is the stage in which dementia symptoms become severe to the point where a patient requires help with everyday activities. The person may also have symptoms that indicate that they are near the end of life. What causes dementia to worsen? Vascular dementia, a problem with blood vessels. Damage to small blood vessels deep in the brain can cause dementia that worsens gradually, like Alzheimer's disease. When damage is due to a major stroke, potentially due to the blockage of a major blood vessel, or a series of small strokes, symptoms occur suddenly. What should you not say to someone with dementia? Do you remember? And other things not to say to someone with dementia. Stay in the present moment. Avoid asking the person questions about the past, rather, tell your own stories that don't involve the person's input. Avoid distractions. One step only, if asking a person with dementia to do something active. What is the life expectancy of someone with dementia? Generally speaking, the life expectancy of a person with dementia depends on the type of dementia they are diagnosed with, their age and health. Most studies seem to show that the average number of years someone will live with dementia after being diagnosed is around 10 years. Which is worse, dementia or Alzheimer's? Dementia is an overall term used to describe symptoms that impact memory, performance of daily activities, and communication abilities. Alzheimer's disease gets worse with time and affects memory, language, and thought. While younger people can develop dementia or Alzheimer's disease, your risk increases as you age. Do people with dementia sleep a lot? It is quite common for a person with dementia, especially in the later stages, to spend a lot of their time sleeping, both during the day and night. Sleeping more and more is a common feature of later stage dementia. What are the signs of end-stage dementia? Tips for managing dementia. End-of-life signs. These signs may include moaning or yelling, restlessness or an inability to sleep, grimacing, or sweating. This may also signal that it's time to call hospice or a palliative care team to help with the pain management. How do dementia patients die? The actual death of a person with dementia may be caused by another condition. They are likely to be frail towards the end. Their ability to cope with infection and other physical problems will be impaired due to the progress of dementia. In many cases, death may be hastened by an acute illness such as pneumonia. Does dementia affect walking? Dementia inhibits the ability to walk. Dementia can affect areas of the brain that are responsible for movement and balance. Many individuals affected by Alzheimer's and other types of dementia gradually lose the ability to walk and perform everyday tasks. What medications make dementia worse? Medications. Some drugs make dementia worse. Benadryl, found in cough syrups, and over-the-counter allergy and sleeping pills such as Tylenol PM. Bladder pills such as tolterodine, Detrol, oxybutynin, Ditropan, Tropium, Sanctora, do help when patients need to urinate often. What are signs of advanced dementia? These may include increased agitation, depressive symptoms, anxiety, wandering, aggression, or sometimes hallucinations. Bladder incontinence is common in the later stages of dementia, and some people will also experience bowel incontinence. Appetite and weight loss problems are both common in advanced dementia. Do dementia patients know they have it? Alzheimer's disease progressively destroys brain cells over time, so during the early stages of dementia, many do recognize something is wrong, but not everyone is aware. They may know they are supposed to recognize you, but they can't. How do you know when dementia is getting worse? It becomes harder to perform regular daily activities and self-care as dementia progresses. Common symptoms during this stage include increasing confusion or poor judgment, greater memory loss, including a loss of events in the more distant past. What is the best anxiety medication for dementia patients? 5 types of medication for difficult behaviors in dementia: risperidone, brand name Risperdal; quetiapine, brand name Seroquel; olanzapine, brand name Zyprexa; haloperidol, brand name Haldol. For a longer list of antipsychotics drugs, see this NIH page. What are the first signs of your body shutting down? They could have different sleep-wake patterns, little appetite and thirst, fewer and smaller bowel movements and less pee, more pain, changes in blood pressure, breathing, and heart rate, body temperature ups and downs that may leave their skin cool, warm, moist, or pale. What are 5 physical signs of impending death? 5 physical signs that death is nearing: loss of appetite. As the body shuts down, energy needs decline. Increased physical weakness. Labored breathing. Changes in urination. Swelling to feet, ankles and hands. Is it illegal to leave a dementia patient alone? In general, once a patient enters the moderate phase of dementia, the phase in which they require some help with their basic activities of daily living like dressing, bathing and grooming, it is unsafe to leave them alone for even short periods of time. What stage of dementia is incontinence? Many people will experience incontinence, a loss of bladder or bowel control, in the later stages of Alzheimer's and other dementias. There are many causes, as well as ways to help manage incontinence. How you respond can help the person with dementia retain a sense of dignity. Does dementia run in families? Many people affected by dementia are concerned that they may inherit or pass on dementia. The majority of dementia is not inherited by children and grandchildren. In rarer types of dementia there may be a strong genetic link, but these are only a tiny proportion of overall cases of dementia. Why do dementia patients refuse to eat? Eating behaviors: a person with dementia may refuse to eat food or may spit it out. This may be because they dislike the food, are trying to communicate something such as the food being too hot, or they are not sure what to do with the food. Does dementia get worse at night? Sundowning is a symptom of Alzheimer's disease and other forms of dementia. It's also known as late-day confusion. If someone you care for has dementia, their confusion and agitation may get worse in the late afternoon and evening. In comparison, their symptoms may be less pronounced earlier in the day. Does dementia ever improve? Dementia treatment and care. Treatment of dementia depends on its cause. In the case of most progressive dementias, including Alzheimer's disease, there is no cure and no treatment that slows or stops its progression. But there are drug treatments that may temporarily improve symptoms. How do you calm an agitated dementia patient? To prevent or reduce agitation, create a calm environment. Remove stressors. Avoid environmental triggers. Noise, glare and background distraction, such as having the television on, can act as triggers. Monitor personal comfort. Simplify tasks and routines. Provide an opportunity for exercise. What drugs are used to calm dementia patients? But common ones that can ease agitation include medicines that treat paranoia and confusion, called neuroleptics or antipsychotics. Examples of these are aripiprazole, Abilify, haloperidol, Haldol, olanzapine, Zyprexa, quetiapine, Seroquel, risperidone, Risperdal, and ziprasidone, Geodon.